right. That's great. All right. So good afternoon, everyone. Thank you so much for joining us for the second Bromley Bible Center's Knowledge Share and Exchange webinar on virtual communication. Is that the way forward for community engagement? So as part of the new online resources library and webinar series, we are delighted to present a special online session to talk about the specific impact of the move towards online and virtual communication to stay in touch with communities. So in terms of the lockdown and social distancing, obviously most organizations have already adapted the way they interact with other people. So through online means and also via the phone. And this has prompted fast changes that would not have happened otherwise. So communicating with people remotely has certain advantages that can now be taken into account for a lot more carefully for the new normal, as we call it now. So on this webinar today, we'll be looking at the following themes around phone and online communication. So the opportunity, so what are the new ways of communications and how do they allow a more holistic approach to community engagement and to reach out to members of the community who would not normally take part in activities held at the center. What are our current challenges? So obviously virtual communications allow a lesser degree of engagement. How can we keep engaging with our community in a meaningful way while we can't see them? And how can we support people with using new technologies as well? That's a great challenge at the moment. Next stage, so how can we involve and outreach to people without internet access? And how can we ensure everyone is comfortable in the new ways of interacting? So these topics, will be covered by my experience from the Bible Center colleagues who have accepted to let us know a bit more about how the lockdown situation has impacted their work and what they've been doing to keep delivering services to our community. So first, Candice Thomas from the social care, who is the social care team leader at Bromley Bible, will be letting us know about her work at the center at the moment and how the lockdown has impacted her work. Rose Fraser, with the Arts and Health Product Manager, will be letting us know a little bit more about the street photography course she's been running and moving online. And Layla Shirreh, who is the social prescribing manager, will be letting us know about the impacts on social prescribing and what they've been doing as well to support people within the community. We'll then have, actually it's the other way around from the slides, but we'll have a think together activity. So we'll be discussing in breakout rooms of 10 people you'll be given topics and we'll kind of feed back to everyone afterwards. So that will be a little activity. And then afterwards we'll have a discussion and question and answers with our panelists. So yes, that's what today will be. And so first, I would like everybody to actually answer a very short poll with a couple of questions. That will allow us to know, and you all to know who is in the audience. That would be nice. It's just asking what sector you work in and where you're based. So I'm going to launch the poll now. So you should be able to see it now. And hopefully you can all enter it on your screen. We should be seeing yes, perfect. So I'll leave you just a couple of minutes. I see people have started introducing themselves on the chat as well, so that's very good. And we're already, we're 234 people now on the webinar, so that's great to see. This is an important and interesting topic for everybody. All right, that's amazing. So let's have a look at the poll very quickly. We can see that it's quite varied actually. A lot of people, half of people present here are from the voluntary sector and community organizations, as it seems. And most people are somewhere else in England. That's great. Very interesting. All right. Well, now that we have a little bit more of an idea of who's with us on the webinar, so I'm gonna put an end to it now, and we'll have Candice. We'll have Candice kind of. Oh, you can see the no. Candice. So like I said, work in social care, and she will be letting us know for 5 minutes about what they've been doing in her program. So Candice, I'll leave the floor to you.
Good afternoon, everyone. Hope everyone's keeping well and safe. So I'm the social care team leader over at the Bromley by Bow Centre. So we officially went into lockdown. Well, our service officially closed at the centre on the 25th of March. We support clients, adults over the age of 18 upwards with learning disabilities and mental health support needs. So the whole lockdown for us has been pretty difficult because we've had to adjust to supporting our clients in a more remote way, virtually. And for some of our clients, given some of the needs that they have, it has been quite difficult. So usually the way our service would work whilst at the centre, we would have artists or facilitators come in and run sessions for our clients Monday to Friday. And those sessions could be anything sort of like from art-based, exercise, cooking, horticulture, various different sessions throughout the week, Monday to Friday. So we've now had to sort of adapt the way that we're working via running some of these sessions online via Zoom. Some of our clients at the moment, we've been quite lucky with the support of some of our clients, like family members they might live with. Also, some of them might live in a residential setting, so we've had support from some of the staff at the homes, which has been pretty good. It's been difficult because we've had to go through, and that's a big challenge that we've had, having to sort of work with individual clients and get them set up on Zoom. And some people are quite uncomfortable, you know, like wanting to be seen on camera, and for some of them it's quite daunting. So that's been quite a big challenge that we've had to go through. It's also been difficult, whereas all our clients now are at home, a lot of their family members who they might live with, them coming into our centre is like a form of respite. And for some of our clients who may have significant mental health needs, that can be sort of challenging for the family members. So where that support now has been taken away, it's put added pressure back onto the family. So we've experienced a lot of sort of issues there since clients have been at home. But what else we've been doing, so we've been running sort of like seated exercise sessions via Zoom. We've been running sort of virtual cooking sessions. We host sort of like coffee mornings and quiz afternoons with the clients as well. So something just to keep them engaged, a bit of fun as well. And they're able to see, you know, their peers, their friends as well via the Zoom online calls. And we also do like a mail out. So for those clients who we do have who find it very difficult to access the internet, we do a mail out to them. So we send out sort of art packages which might contain different activities within. We also send out like recipe cards, and so they can sort of practice making their own recipes at home and then sharing the pictures with us of what they've created, which is quite fun. And we've also done sort of like horticulture mail out. So we'll send them like seeds that they can plant. And that's been very good because they send us through all the pictures like via WhatsApp. Oh, this is what I've done. Like I've been growing radishes. It's really fun. So it's nice to see that, you know, that they are able to still engage with us, which is really nice. Going forward, it's given us a lot of time to think. I mean, obviously going with the government guidelines, we're still unsure as to when we'll be able to open again. We are hoping for July, but then it's hard to know really what might happen. But even so, for a lot of our clients, those especially who are shielding or who are over a certain age, it's hard to assume that we'll be able to see them come back to the centre anytime soon. So where we might open up the centre and some of our clients might return, for those that are unable to, the idea would hopefully be that we'll be able to still continue some of what we've been doing remotely still, which means continuing doing some sort of level of online Zoom exercise groups or some sort of engagement groups that we've been doing so far. But it has impacted our service in a way, because we're not able to sort of provide, you know, the same level of what we was doing before. But it's people have been, like, most of our clients have been very supportive, the families have been very supportive, and it's been quite nice to see, you know, everyone sort of wanting to be engaged and wanting to get involved in the sessions and so on. So yeah, it's not been the easiest. I mean, I think lockdown's definitely brought us some challenges, but we're working through. And yeah, I think that's about it, really.
Thank you so much, Candice. That's really interesting. And if anyone has any questions for Candice, feel free to already put them onto the chat box, and we can kind of address them in our discussion a little bit later on. Right, so next is Fraser. Like I said, she's going to let us know a little bit about her street photography course. So Rose, I'm just unmuting you now. Rose, can you hear us? I'm not really sure. Yes, perfect. Yep. All right.
Can you see me?
Yes, we can see you and we can hear you.
Great. Hi everyone. Hi, my name's Rose, and I run some of the arts and health projects at the Bromley by Bow Centre. So we run a kind of a range of kind of creative sessions, including kind of theatre and dance and music, visual arts. And the first thing to say about how we've adapted, I guess, is that we were quite practical in our approach, and chose what kind of works well online, and that was quite sort of, in some ways, sort of the easiest thing to do online, which for me was the kind of the photography and film work. And we've kind of ramped up our delivery on this over the last couple of months. So in photography, we run a 6-week photography course with about 10 participants each time. And we have different sessions. The first one's about introducing a self-portraiture, introducing yourself. Then I think it's our new relationship with food. We then nostalgia, our new world. And people have found it I think a really useful way to kind of respond creatively to what is happening in these times, and to connect with other people. And filmmaking, we've been doing working with smaller numbers, sort of 4 to 5, and supporting people making short films, sort of a day in the life type films. For us, it has been an opportunity to reach more audiences. It's been the courses are kind of popular, and we find that retention is high. They tend to be shorter. So we work with people for an hour. Rather when we're with people face to face, we can have a kind of longer we tend to be 3-hour sessions. And I suppose big difference for us is normally when we work with people face to face, all of the the main part of the creativity and the content that the participants are producing are in those sessions. But now we ask people to, the sessions are really about the tutor delivering the session and introducing the theme and discussions around that, and then the students go and do the delivery outside of that, which has been a change for us. I think it's how it's sort of it's how it's had to work. Content to the sessions obviously has to be kind of tighter, and whoever's delivering the session has to be really wary of pace and keeping people engaged, which is difficult. We found some of our groups, we've had more than 10 people, which doesn't work so well, to try and get a sort of cohesion in that group and people to get to know and to support each other. We found that there has to be more kind of pastoral care outside of the sessions. So normally when you deliver face to face, I think the expectation from participants as they arrive for those however many hours and are supported by you in that time, and all get to know each other and do, engage in the creativity, and then there isn't so much contact sort of outside of that. But we have found that people need quite a lot of support out of that. Just that sometimes they find the assignments challenging and they need to talk it through, or there might be sort of dynamics in the group that they're not sure about and they need some support with. So we found that's obviously quite different. And I suppose one of the things, thinking about the kind of outcomes for people, we've definitely been able to push people and develop their skills and knowledge and confidence, and they've created beautiful pieces of work. But there is obviously less opportunity for connection between participants and us as a group. You do get like moments of, I think there are a lot of moments of like joy and connection, and that kind of experience, of all of us together, like learning how to use Zoom, trying these things, and mistakes happen and technology doesn't work, and everybody's pretty gentle and forgiving and enjoy those kind of moments. But it doesn't lead to, I don't think, the same kind of level of support and the journey that you can go on with participants sort of outside of kind of when you're with people face to face. Yeah, so I think I've talked about kind of yes some of the challenges and thinking about what we'll take forward. I think there will be things. I feel like we've all been kind of sort of ploughing on, trying to kind of make this work and trying to continue with some delivery, and still don't really, kind of need to take a bit of a breath at some point and work out what we feel is worth taking forward, and obviously kind of desperate to get back to be able to work with people face to face, because that's, it does work. It works better that way for me. I think that's my sort of 5 minutes.
Yeah, sounds good. Do you want to try and show us the pictures, some of the pictures? I've made you co-host, so you should be able to share your screen.
Okay, let me do, see if I can do that.
If you look at the bar on top of the screen, you should be able to see, or at the bottom, I'm not sure where it is for you.
Okay, sorry, give me just 2 minutes, hopefully less.
And yes, everybody, the webinar is recorded and will be available later on in a couple of days on our website. We can show that a little bit later on if it's not working for now.
Fine. It's I think I'm doing the same as
yeah,
you were saying.
it's fine actually. Yeah, we can see.
Okay.
I think it's quite nice to see the result of some of what you're doing.
That's as I said, we sort of introduced each other on the first weeks. So that was kind of the first topic was about ourselves. And then
great pictures.
I think this is our second year, our kind of new relationship with food. The long queues. Everybody used their phones to take the pictures, and yet you could definitely see their work improve pretty quickly.
Yeah,
this
definitely.
The final week we had to go on a journey. So we had to go on a holiday and take 4 photographs from our sort of homes or gardens. So this is me who went up to northwest Scotland. This is Dave, who's in the back of his garden. He went to Borneo.
Oh wow, that's great.
Angela went to Mauritius. Yeah. So yeah, so I think people found it really fun doing different things, being creative.
That's really cool. Awesome. Thank you very much for sharing. That's great.
Pleasure.
I see lots of nice comments about the pictures. All right, so let's move on now. Thank you very much, Rose, for this. That's great. And now we're going to move on to Layla. I think, Layla, you should be unmuted. I'm not sure if you can say. Hey, Layla.
Hi, guys.
Hi.
Sorry, I don't have any lovely images like Rose.
You've got nice slides though. All right, I'm going to share the slides again, but yes, feel free to get started and let us know a little bit more about social prescribing Bromley by Bo at the moment.
So I'm just going to talk really briefly, guys. I think I have a few minutes, but if anyone has any questions, I've got my email address at the end of the slides if you want to ask anything. Yeah, so my name's Layla. I work for the social prescribing service at the Bromley by Bo Centre. I've been working for the team since January, but I've been working at Bromley by Bo for about 5 years now. Slide please, Berenice. So just to give you guys a bit of a background on our social prescribing service, it was developed to sort of address the health inequalities in the local community, with an understanding that there were wider determinants that affected an individual's health. We currently take referrals from 6 GP practices that make up our local primary care network, which is Network 6. And we support people with non-medical needs, and the majority of the needs that we find people come to us with are usually social welfare issues, such as needing debt advice, needing housing advice. We have people coming to us with mental health needs, such as anxiety and depression, social isolation. We have people coming to us that need support with employment issues, getting access to things like ESOL courses as well, weight management. So there's a wide variety of issues that we support people with. The service offers up to 6-hour-long one-to-one sessions. And before the lockdown happened, we were primarily doing that face-to-face. And so there's been a lot of change since the 16th of March, we've been sort of working remotely, sort of the same time as the practices as well. And it's been a bit of a challenge for us, but it's also been a real time for learning and reflection as well. What's happened since we've gone into lockdown is that we've definitely seen an increase in the number of people that we support. We've not only been getting referrals from our 6 practices, but we're also supporting the borough with the sort of borough-led response to COVID-19. And so we've been getting referrals from Tower Hamlets Council as well. So we also have, we're quite lucky in the sense that our own sort of health partnership has set up a crisis social prescribing team. And that's been led by Emma, who I think was on, Berenice, she was on the webinar a couple of weeks ago, I think, and she spoke to everybody about all of the great things that they're doing. But what's been really helpful with that is that clinicians are able to refer people that have more urgent needs directly to the crisis social prescribing team. So this could be anybody who might need urgent sort of food support, such as access to food banks and stuff. People who might need support with medication, they will go to the sort of crisis social prescribing team. And that just allows for our team to deal with more general social prescribing and be able to provide more sort of longer term support for people. Next slide, please, Berenice. So it's been really interesting because I think like a lot of people have kind of been saying the same things when it comes to working remotely and making that change to kind of over the phone support. There have been quite a few benefits and limitations, and I'm sure that like I'd love to hear what other people's are as well. But I think just from us, on reflection, we've actually found that we're able to. It's made us more accessible to clients. So where we would normally not be able to engage with people who say are housebound, we're now able to make contact with those people. So it's having that sort of telephone support service has made it more inclusive, but also made it more convenient to people as well. I mean, we have people that access the social prescribing service, for example, who work and may not be able to always make those face-to-face sessions, but having sort of that telephone service means that we're able to reach people who we wouldn't normally reach. Another benefit has been greater access to services. So an important part of the social prescribing service is to give people access to services and organisations that can support them with the needs that they've come to us with. And again, for some people, it might be a lack of confidence that stops them from accessing those face-to-face services. But now that we have so much of that stuff that has gone online, I mean, just the services, for example, that the Bromley by Bo service has been offering has been on a virtual platform. And so if people have been able to access sort of some of the services, for example, that Rose is talking about, like her photography course, and exercise services with our health and fitness team, we're able to provide online sort of career support to people. And so people who wouldn't normally feel confident in accessing those services face-to-face are now able to do that from the comfort of their homes, which has been really great. But then at the same time, one of our biggest limitations and challenges has been, I mean, we've always known that there has been digital inequality in our borough. So people that are not confident in accessing virtual platforms such as the internet and, you know, social media and WhatsApp. And so this has become more and more evident and apparent with COVID. It's been a real challenge for us actually to for people services that are all virtual. If they don't always have access to laptops and computers, they might not have a smartphone, but also as well, they may not have the training or understanding in how to access those. And a lot of the times, which is the challenge, is that for a lot of the time, the people that have issues with accessing things digitally are the people that need the support the most. Are the people that are really isolated, are the people that are shielding and that are vulnerable and that really need access to these platforms. So those are things that we're starting to think about. I know the Centre as an organisation has set up a digital working group, and they're currently meeting once a week to address these issues. And one of the other things is with any kind of, I mean, one of the main things about social prescribing and things that are really important in that service is being able to create meaningful connections with people. And we've been used to doing this face to face, and so it's now getting used to communicating and trying to build rapport and trying to sort of display and show empathy to people whilst on the phone. That can be a bit of a challenge. And another area is environment. We're so used to seeing people in private spaces, and now everybody's at home, you know, and so it's one of the limitations has been for some of our clients, it may be that they have children in the home. They may not have, you know, they may not have the right space to be able to speak to us. Overcrowding is a big issue with a lot of our clients, and so being able to find adequate space and privacy in order to have those one-to-one sessions have been a bit of a challenge for us as well. Next slide, please, Berenice. So, I mean, these are just some tips actually that we've found helpful as a service when it comes to speaking to people over the phone. I'd love to hear if anybody has other tips as well. This is not like, I'm sure there are so many other ways that people have been able to kind of engage with people over the phone. So I'd love to hear that. But for us, it's just trying to keep things as normal as possible. So, you know, in social prescribing, in our sessions, we tend to do contracting, we prepare for our one-to-one sessions. And these are things I think that should continue, even if it is over the phone. We have things like template, telephone conversations, and actually you can find those on the website as well, and I'll send you a link to that in a minute. I mean, active listening skills is a really obvious one, but I think it's even more obvious now that we don't have the aid of looking at somebody's non-verbal communication to indicate how people are thinking and feeling. So it's even more important, I guess, to hone in on those active listening skills. I know for me, I have a habit, and I tend to always nod when I'm doing my one-to-one sessions to show people that I'm listening. And now that's been taken away from me, I'm like having to just, I suppose, summarize what people are saying, repeat it back to them, just to show them that I've acknowledged and I've heard what they've said. Tone and pace of speech is a really important one. Again, I know for me anyway, personally, I tend to speak fast a lot. Even in this webinar, I'm trying to slow down how I speak. But things like pace of speech and tone are really, really important. I mean, a number of our clients don't have English as a first language as well. And so they really rely on those non-verbal communications. And with that taken away again, it's really important that we're able to articulate ourselves clearly with the appropriate pace of speech. And I guess just like checking in with clients as well, just to see how they're doing within that conversation, within that session, to make sure that they've understood everything, to make sure that you've understood what they've said is really important. Peer support I've put on here just because we've been finding that especially with COVID, we're dealing with a lot more people that are becoming increasingly more anxious, increasingly more isolated. And on a number of occasions, we're having to deal with people who are, you know, having sort of suicidal ideation and things like that. So it's really important that as a team, we're able to talk about any challenging cases that we've had. So setting up something like peer support is really beneficial. And then another thing I've put down here is just making sure that we're up to date on information on services. As I said, like providing suitable services to our clients within those sessions are really important, but especially with COVID-19, there are a lot of sort of organisations and services that have changed the way that they've worked. And then there are new things that are sort of cropping up as well. And so it's important to sort of keep up to date with what's happening so that we can better inform the people that we're supporting. And that ties in with sort of any government related guidance. For a lot of people, they may not have access or knowledge to what's happening with regards to COVID in terms of sort of information for shielded patients, vulnerable patients. So it's important just to keep on top of that in case clients ask you any questions on that. And then the final slide, Berenice. Yeah, and that's it from me, guys. I've just put down the website for the Bromley by Bow Centre, specifically the Insights team, because there's some really useful free resources that you can access. that I've accessed as well. So there's stuff on like supporting individuals over the phone, like templates that you might find useful. There's also access to like previous webinars as well. There's just loads and loads of stuff that you might find helpful. And then if any of you guys are interested in any specific link worker training as well, you can contact our training and development manager, Najnin, who can give you some more information on that as well. And then I've just put my email down there if you wanted to ask me any questions, but also I'd love for people to share what they're doing, because I know most of us are working in this way now, so I'd love to hear like what people have found helpful and useful, particularly the area around digital inclusion as well. And just another thing that I didn't mention actually quickly, sorry Berenice, is our health partnership have developed a really useful home pack actually, that's really interactive, and that's being sent out to our shielding and vulnerable patients who may not be able to have access to sort of virtual platforms as well. And those home packs just contain really interactive ways and activities that they can do at home, and information on services and stuff. And that's on our website as well for you to access. And that's it, Berenice. Thanks, guys.
Absolutely. Thank you very much, Layla. That's really good. Really, really interesting. And I think I've seen a few other people sharing their tips. So that's really interesting to see what everybody is doing at the moment. So now we're going to move on to your kind of conclusion or what you've talked about with your group. And then I'll ask two people to come forward and maybe let us know a little bit, very briefly, in 1 minute maximum, what they've been talking about with their groups. So if someone from group, please manifest yourself within the chat group, so I can call you. Someone from group 5, actually, yeah. Who was spokesperson from group 5? If you just put a little word, or someone from group 5 who wants to present in the chat, and then I can call you and allow you to unmute yourself now. Anyone from group 5? Group 6. Well, let's go for group 6 then. Right. So Helen, let me just unmute you, and you can let us know what you've been talking about in your group.
Hi. So we had the topic of how we're supporting people without access to the internet. Sort of 3 key themes. One was to utilise the younger people in the household or remotely by getting them to support their older person with technology to get them the access. A couple of organisations have got like an IT guru, which has been able to support people once they've got the access to the IT. Not to minimise the importance of the use of the telephone, and we really concluded that there needs to be some sort of national level solution. For example, putting exercises on the red button on the BBC service so people can access that, because most people have got a TV if they haven't got the internet.
Okay, that's interesting. That's really interesting. All right, thank you very much, Helen.
And there was a good link called the Good Things Foundation, which are a national sort of technology organisation that somebody's got some loans of iPads from. So,
all right, yeah, great. Thank you so much for sharing. Right, so now if someone from group 1 could present. I don't know, I have names in front of me, so I could call out, but does anyone from group 1 want to let us know a little bit about what they've been talking about in groups? Oh, yeah, all right. Helen, some people are asking on the chat if you could say again about the name of the group. All right, Cristiano, let's unmute you and you can present for your group. We'll do group 17. Let me unmute you now.
Okay, so
hi.
I'm from the group 17. I'm a GP, but most of the members of the group are they work in the community sector. So we have been discussing how do we manage the engaging clients without face-to-face sessions. And actually, most of the members said that the phone is the main solution still. Okay, so and actually the clients kind of appreciate it, and they use it very easily, the transition from face-to-face to phone. Then I was giving some examples from Lisbon that as a GP, a lot of times I have to communicate with elderly people over the phone, and sometimes internet actually is very helpful to, for example, if someone has a problem and I need to see a picture of that problem or something like this. And something that was very nice is a lot of our elderly people, they don't know how to use internet and email, and some community sectors organizations were kind of providing this link, so they would help elderly people to collect information to send to the GP, and they would send to the GP on behalf of the patient. And so imagine some pictures from a skin problem, something like this. So that was quite nice to see community sector providing the link between people without digital skills with the GP. Also, even though like most of people feel comfortable using the phone, I remember as well about some patient who didn't have phone. Okay, she lost the phone, and so during the COVID crisis, she could not communicate at all with anyone, with GP, with any kind of public sector. So through the social prescribing service, we managed to arrange, just find a phone and provide a phone to the client, so she could communicate with GP and family members and who else she needed. So well, that was kind of the solution. But most of even though some of the organizations in discussion team said that they try to motivate like webinar solutions or like Zoom kind of engagement with clients, most of the clients were not prepared for this, so they would prefer the phone. So yeah, we have to work on digital inclusion in the future. I think this is an opportunity.
Great, that's really interesting. Thank you so much for sharing, Christiana. And we have just a couple of minutes. Sorry, everyone. Just a couple of minutes to ask some questions. I think there were. So I'm going to unmute Candice, Rose, and Layla again. And one of the questions that came back was, how are you planning on continuing those programs? Those online programs in the future, or is it for now just temporary? I think you should be unmuted, Layla, Candice, and Rose. So what do you think? How is there any planning on continuing those?
For me personally, most prior to lockdown, our service was mainly based on site, but given with the current situation, it's sort of difficult to say, but it might mean that for some time, for at least for the next few months or so, that we will continue some of our sessions virtually or remotely, only because we wouldn't expect that all of our clients will be able to return, especially those who may be shielding or you know, are over a certain age. I mean, we do have quite a few clients that are like 70 and above, so we wouldn't expect them to come back sort of very, very soon. So that on my part.
That's fair enough. What about you, Rose and Layla?
Yeah, so I think we might, in the fact that it's a way to kind of reach more people, and once you know the sort of the design of the delivery is it's sort of done now, and it kind of runs quite smoothly. So I think we probably will continue doing it, but I think we will be keen to get pretty quickly to being able to work with people face to face as well, do the sort of blended model of delivery.
That makes sense. And another question was also about how any tips for engagement to start new activities? So people were asking about, okay, all the activities that you're already running, are they with people you already have an existing relationship with, or are they sometimes with new people? And how would you engage with new people now that we can't really see them or whatever? People were saying they've tried calling people sometimes, but it's not working very well, and word of mouth is not working when it's a new activity. So how would that work? Do you have any tips for that?
I think for me, I would say, I guess it's quite self-selecting. The people we advertise on, you know, through the different kind of WhatsApp groups that we all have at the centre, and through our Twitter and Facebook and social media accounts. And then I've used, which I've never done before, because there's so many more Facebook, you know, the mutual aid Facebook's accounts and Tower Hamlets residents. So we've met people, got people in that way. So we have got new people in, but I don't. It's quite a different relationship that I have with people, and it's obviously self-selecting. It's people who feel relatively confident to use Zoom and sort of engage in that way. So I don't have any real tips of engaging people who don't use those mediums at the moment, which is something, if we carry on, you know, depending on how long we go on for this, we'll need to start thinking about that more seriously. But I think we just, at the beginning, just were quite pragmatic with what we've decided to do.
That's fair enough. And Candice, I think that through the exercise sessions, you've been able to engage with the whole family sometimes as well. So like people wouldn't normally be engaged. Can you tell us a bit more about that?
Yeah, so I tend to keep quite a good relationship with most of our clients and their family members where possible. But sometimes it's hard to sort of reach out to those, especially some of our clients who we might have that are more independent. So you wouldn't necessarily have that sort of relationship with their family members, and also those of staff who might live in residential settings. So I've had to engage a lot more with the managers of those homes, and sort of, obviously if I can't speak to the client directly, then that would be my next point of contact. And it's sort of nice to be able to build that relationship with them and work together to sort of get the client to be able to get involved in what it is that we're currently delivering, and allowing us, with their support from them, to, you know, encourage the clients to be able to engage and access our service, at the moment it being remote. So it's not been easy, but definitely interesting, and it's been very, very helpful with the support that we've had.
That's great. Thank you so much. Thanks so much for sharing. Layla, do you have any last words to add on this?
Just echo what Candice and Rose are saying. I think like it's not ideal, but it's the situation that we find ourselves in. I think for us, face-to-face contact and sessions will always be a gold standard for us. But I think that with telephone sessions, it's only going to enhance and strengthen the service, even sort of after we come out of the pandemic. It's definitely something that we will continue to use and provide as an option for people to make it more inclusive.
Absolutely. Thank you. Well, thank you, everybody. It was a very nice session. I hope you all enjoyed it. Most of you have already voted on the feedback survey, so that's really cool. Thank you very much. Our next webinar will be held in exactly a month. So that will be on the 9th of July. So we're looking at material well-being for improved mental health. Obviously, we'll be looking at the topics that you've been kind of put you know, the most interesting topic for you in terms of the next webinars or content. So we'll take that into account as well. A link will be sent to you in a feedback, in a follow-up email after this webinar, as well as the recording and the link to the slides as well. So I hope you all have a nice rest of your week and a nice rest of your day. And thank you so much for joining us today.
Thank you.
Thanks,
Thank
Berenice.
you. Thanks, everyone.
Thank you.
Bye, everyone.
Bye.